Welcome to the EPICC-COVID19 Introduction to Hemodynamics. I am your host, Alan Lai. We're going to be talking about what makes up cardiac output. The first component of cardiac output is the pump, which is the heart. The second component is the tank, or how much circulating volume there is. And the third component are the pipes or blood vessels. The last component that makes up cardiac output is the heart rate. When we put these four concepts together, we get cardiac output. We'll be using the oxygen supply-demand framework to guide this conversation. It can be found on the EPICC-COVID19 website. You can follow along in the red shaded area on the framework. We're going to start with three components of stroke volume. First, let's dive into the pump, which is the heart. Its main job is to pump blood around. Its ability to pump is dominated by a number of issues, but more so by pre-existing disease such as reduced ejection fraction. To function properly, it needs just the right amount of squeeze. When we talk about the tank, we are referencing preload. Preload is the result of the circulating volume within the vascular space. We often modify preload by giving IV fluids or blood. The last component of stroke volume are the pipes or blood vessels. The pressure within the pipes is called afterload. The higher the afterload, the higher the blood pressure. The most common drug we use to increase the squeeze is norepinephrine. The pump, tank, and pipes contribute to stroke volume. The last component of cardiac output is the heart rate. The heart rate typically goes up in times of decreased stroke volume to compensate. The body tries to find just the right rate to balance cardiac output. So let's summarize. The pump is contractility, the tank is preload, and the pipes represent the blood vessel tone, which give us the stroke volume. The final component in cardiac output is the heart rate. That's all for now. Thank you for listening.